Hi, I'm Jim Gill. I'm the current president of MAME and a practicing forensic pathologist. Thank you for your interest in forensic pathology. For those of you who have not heard of MAME, it's the National Association of Medical Examiners, and it is the professional society for forensic pathologists and medical legal death investigators. We are the equivalent of the American Academy of Pediatrics is for what pediatricians are. We're just not that big. I'm here to introduce you to some colleagues to tell you about how they became forensic pathologists. I hope that after these talks, you'll be even more interested in our specialty. It's really an exciting time for forensic pathology. There's a great demand around the country for forensic pathologists. We're actually a pretty small group. There are only several hundred of us practicing board-certified forensic pathologists in the United States. And this demand actually has helped increase salaries and provide other benefits as well. The federal government also has taken an interest in our work and is looking towards things like student loan forgiveness. So after medical school, to become a forensic pathologist, one needs to do a residency in anatomic or anatomic and clinical pathology, followed by a one-year fellowship in forensic pathology. If you've not already done so, it's important for you to spend some time in a medical examiner or a coroner's office to see what it's really like. And I encourage you to do that, and I'll talk more about that a little bit later. A common question that forensic pathologists receive is, why in the world did you decide to become a forensic pathologist, a medical examiner? The answer varies, but for some of us, it started when we first learned about forensic pathology. The late Dr. Charles Hirsch, who's the former chief medical examiner of New York City, once said that when he started his residency in pathology in 1963, he had no interest in forensic pathology. He said he could not have because he didn't even know the specialty existed. It wasn't until he attended a monthly lecture at the coroner's office given by Dr. Lester Adelson that his eyes were open to a fascinating and vastly different perspective on pathology. The fact that you're watching this, I know that you already are aware of the specialty of forensic pathology, so we have come a long way since the 1960s, but we still need more people to work in our field, and workforce issues are something that NAME has at the top of its agenda. The pathology of the hospital and the clinic is only one profile of human illness. The flip side is the pathology of the street and home as observed by the forensic pathologist. It is a different pathology, and its interpretation requires the application of medical legal logic as well as scientific reasoning. Where else but in the medical examiner's office will you see the full course of natural disease uninterrupted by medical therapy, as well as all the varieties of trauma? Let me tell you that the only people who think that trauma is simple are those who haven't seen it or those who have not thought about what they have seen. Today, thanks to television, movies, and books, some excellent and some awful, many people know about forensic pathology. I know several forensic pathologists, myself included, who mentioned Dr. Noguchi's book as one of their first exposures. Many first discovered their interest in forensic pathology during high school. The plus side of this forensic pathology media blitz is that it has popularized our field and even made it look cool. But let me be frank, forensic pathology, like any other occupation, has its pluses and minuses, but it is indeed a very cool profession. Now I'm going to tell you why. The late Dr. Lester Adelson said that a forensic pathologist is the last true generalist in pathology and in medicine. The forensic pathologist must be knowledgeable about surgical pathology, neuropathology, pediatric pathology, and the various surgical and medical specialties as well. For me, what I love about forensic pathology is that it's seeing something different every day. Dr. Hirsch would say when he walked into the office each morning, "Time to see what God and the devil left on my doorstep last night." How many other medical professionals can find out what their day will be like by turning on the television when they wake up in the morning? How many times in the morning has my wife said to me, "Are you going to get that one?" And I say, "We get them all." It can be an exciting and challenging, intellectually stimulating and rewarding profession. It is different every day. You never know what you're going to be surprised at when you find at autopsy or at the scene. What other occupation involves the practice of medicine and the improvement of medicine by helping clinicians learn from their misdiagnoses or mistakes, which may help future patients and improve the public health? What other occupation also involves working with the criminal justice system to help in the search for truth and justice? What other occupation also helps improve the public health? What other occupation also are educators, teaching in the classroom, teaching in the courtroom, the autopsy room, or the office when speaking to families? This occupation also allows you to conduct research, be an academic forensic pathologist, or work in a big city office or a small rural county office. The hours are very reasonable, as many offices now have 24/7 investigators, and this allows for a very good quality family life. Dr. Randy Hanslick, the retired chief medical examiner of Atlanta and Fulton County, wrote about the value-added forensic autopsy. The autopsy is not just to determine the cause of death. Information from our investigations can help many other stakeholders. These include the Consumer Product Safety Commission, the Food and Drug Administration, health departments for notifiable infectious diseases, the Bureau of Labor Statistics for occupational fatalities, the National Center for Health Statistics, the CDC, the National Violent Death Reporting System, and then local, state child fatality review teams as well. The late Juan Rosai, a revered pathologist, edited a book about surgical pathologists called Guiding the Surgeon's Hand. It emphasized the role that pathology diagnoses play in helping the surgeon or the oncologist or the gynecologist decide what treatment, if any, is needed. If such a book were written about forensic pathology, it would have to be entitled Guiding the Physician, the Detective, the Prosecutor, the Defense Attorney, the Judge, the Juror, the Public Health Official, and the next of kin. One of our solemn services is being the family's bereavement physician. Our practice touches the work and the lives of all of those above people. My first forensic work exposure was during college. I majored in biology, and one summer I worked as a summer intern at the serology section of the State of Connecticut Crime Lab. This was before DNA testing, so it kind of gives you a sense of, it was a while ago. Henry Lee was the chief of the lab at that time, and he helped further stimulate my interest by helping on casework and often even going to crime scenes. Heading to medical school, I was pretty sure that forensic pathology was for me, but I wanted to see what it was actually like and experience a bit more. Now, I went to medical school at the University of Connecticut, and on the campus is the Connecticut Medical Examiner's Office. So during my first year, I decided to reach out to them, and I had two names to call, the chief and a senior pathologist. I started with the senior pathologist, who told me that they don't take any visitors and that I would have to wait until my fourth year to do an elective there. Well, that wasn't quite on my time schedule. I really didn't want to wait until the fourth year. That was going to be too late for me. So I kind of bit the bullet and I called the chief. And I'm glad that I did, because the chief at that time was Dr. James Luke. And he invited me over, which then led to a summer research internship at the medical examiner's office. Dr. Luke paired me up with their newest medical examiner who had just started there. He had just finished his fellowship in North Carolina. And that forensic pathologist was Kurt Nolte, who's now with the OMI in New Mexico. So during that summer, I was in the autopsy room every day. I also got to go to some crime scenes and even watch some of the medical examiners testify in court. I was hooked. It has become kind of full circle now, because now I'm the chief medical examiner at that same office. So whenever now I get a call from a medical student, I always think of the opportunity that Dr. Luke gave me. Medical examiners like Dr. Luke and Dr. Adelson and Dr. Hirsch are responsible for many, many people going into forensic pathology. During my training time, there was a clinical year requirement for pathology certification. So many forensic pathologists that I asked about this suggested that I do an internship in medicine. It would be very helpful in forensic pathology. So I did. I did this in Vermont, and having a strong foundation in medicine is very helpful with investigating many of the hospital deaths that we come across. During that year, I worked part-time as a medical legal investigator for the Vermont Medical Examiner's Office. Following Connecticut, I came back to Connecticut to do my anatomic pathology residency. Yes, I just did anatomic pathology. Some do anatomic, some do anatomic and clinical, both work. During that time, I also did some part-time work as an investigator for the Connecticut Medical Examiner's Office. Now, forensic pathology fellowships often will fill a couple of years ahead of time. So when I started looking around back then, all the positions were already filled. So I ended up doing an extra year fellowship in cancer pathology at Memorial Sloan Kettering. And then following that, I started my forensic pathology fellowship in New York City with Dr. Hirsch. I stayed on as staff in the Manhattan office for 5 years and then became the head of the Bronx office after that. I recall one day when I was still in Manhattan doing an autopsy, and it was on a man who had committed suicide by shooting himself in the head. While I was doing that dissection, one of the mortuary techs walked into the room and they said that a plane just hit the World Trade Center. You all know the rest. All of those remains came through the Manhattan office, and over the next several months, all of the staff in the New York City Medical Examiner's Office worked on those identifications. In 2013, I again returned to Connecticut to become the chief medical examiner. One's initial exposure to forensic pathology is often the fork in the road because it may turn some people away while others are further intrigued and curious. Inquisitiveness is a great attribute to have for a forensic pathologist. A curious mind, a person who likes to figure things out, would find forensic pathology to be a wonderful career choice. It has been said that millions have seen an apple fall to the ground, but Newton is the one who asked why. Let's hear some of these other stories about how people get into forensic pathology from some of my colleagues.
Hi, I'm Alison Krawonzik. I am a cardiovascular pathology fellow at the Cleveland Clinic and am a board-certified forensic pathologist. I did my forensic pathology fellowship at the Cuyahoga County Medical Examiner's Office last year. I first got interested in forensic pathology when I was in undergraduate school. So even when I was younger, I was interested in a career in medicine because we had a family friend who was a family medicine doctor in a rural state, and I always thought that was really cool. So in undergrad, I was pre-med and taking biology classes, and I kind of got this random email advertising an internship at our medical examiner's office. And you know, when I was younger, I had always enjoyed books and TV shows about autopsies and crime solving and things like that, but I never really appreciated that there were people who actually did that work and that was a job that maybe I could do. So I applied for the internship, and on my first day, I just fell in love and realized that this was the kind of medicine that I wanted to practice. So after I finished the internship, I finished up my undergraduate at the University of Vermont. I stayed on and did medical school there as well, and did my anatomic and clinical pathology training at the University of Vermont Medical Center. And I'll say the cool thing about staying in Vermont was that my mentors in the medical examiner's office there really allowed me to come in when I had free time during medical school, during residency, and just spend extra time there and get extra exposure. So those are two people who had a huge influence on me choosing the field of forensics, because once they saw how interested I was as an undergraduate intern, they really took me under their wing and helped me the whole way through, and let me expose myself to autopsies, get involved in research projects. So I think that they were a wonderful resource to have. And to anyone, if you can find someone who's a resource like that for yourself, take advantage of them as much as you can. I ended up doing forensic pathology fellowship and a cardiovascular pathology fellowship because as I went through training, I realized that some of the cases I found most interesting are the cases of sudden cardiac death. So a younger person who dies suddenly and there's not a great explanation for it. And sometimes we find heart defects, sometimes we find congenital lesions, and sometimes we don't. And I think that that field combined with the genetic testing that's being done now and the increased ability of postmortem genetic testing is a really exciting area to explore. So I'm hoping in the rest of my career to be able to combine those two interests and practice forensic pathology, but also be able to focus more specifically on those cardiac deaths and helping families sort of navigate those waters of genetic risk and who needs follow-up after you have a family member die suddenly. And that's sort of why I chose to combine those two interests. If I had to explain to the public the role of the forensic pathologist, I think that there's the intuitive part, the obvious part, which is the homicides, crime scenes, preserving evidence, helping make sure that justice is served in whatever form it could be. But one of the things that I love about forensics, and I think the overlap with family medicine from my perspective, is I think of the forensic pathologist sort of as the primary care doctor for the community that they serve. And anyone who dies and has an autopsy is really getting their last physical exam. And it's important for us as a society to do that and understand how and why people are dying, whether it's natural disease, accidents, overdoses, so that we can understand how to intervene better, how to treat people better, and what's the best use of our public health resources. So in that way, the role of the forensic pathologist goes far beyond sort of the crime TV shows and sort of the thing that the people think of us most commonly as. And we have a big role in public health. Qualities that I think are important to make a successful forensic pathologist are a strong sense of curiosity. I think as a forensic pathologist, you have to be the kind of person who isn't satisfied with the obvious or easy explanation for something, and you have to be willing to dig a little bit deeper and rule out the other possibilities that maybe they're less likely, but you just feel that sort of compulsiveness to make sure before you come to a final conclusion. And one of the other important qualities, I think, is a strong sense of empathy, which, forensic pathologists, and I think pathologists in general, get a little bit of a hard rap for maybe, they don't want to see patients, they don't want to interact with people. But, from my experience, forensic pathologists have been some of the most empathetic people I've worked with. There's no judgment. Everybody comes into this world and out of this world a little bit differently. So you just take everyone as they come. And, you have to understand that whenever we're dealing with families or dealing with people, it's in the worst moments of their life or the worst times of their life. So being able to keep that in mind and keep that perspective is incredibly important, and to remember why we do what we do every day. And let's see, to convince one of my colleagues or friends to go into forensic pathology, I think one of the easiest things to tell them is that it's the coolest job you can have. So whenever I tell somebody that I'm a forensic pathologist, nobody ever just leaves it alone and says like, okay, fine. Everybody says, oh my God, that's so cool. And they want to ask more and know more. And I don't think there's a lot of jobs out there that are like that. The other great thing about doing this work is I get to wake up every day and I get to go to a job that's intellectually demanding, intellectually stimulating. It's emotionally rewarding because I think the work is important and what we do is important. And I think a lot of people aren't so fortunate in life. You know, a lot of people have jobs that they have to do because you need to work, but I am incredibly fortunate to be paid to do what I do. And I love it.
Hello, my name is Angela Baldwin. I am a medical examiner at the Office of Chief Medical Examiner, New York City. And I'm going to talk about how I got started into the field of forensic pathology. So it all started a long, long time ago when I was about 11 years old in 7th grade in biology class, and we got to dissect frogs. And it's amazing that it sticks with me all these years later, but the thing that I was really proud of and excited about was I was the only one in the entire school who was able to remove all the skin off the frog in one piece, and we got extra credit for doing that. But what really stuck with me was when I opened the frog, I just became very enthralled with the way that the organs all perfectly fit together, and just kind of seeing, quote unquote, how things worked, how form and function were just so integrated and just perfectly put together. I think that was the beginning of my interest in anatomy, just seeing how form and function just perfectly work in harmony. So fast forward several years, I went to Stanford for undergrad. And then when it came time for medical school, I had to look for a way to finance that. And so I signed up for the Navy. So following graduating from Howard University College of Medicine, I served as a flight surgeon in the United States Navy. So a flight surgeon is a primary care doctor who flies planes and flies helicopters, and then is a doctor for the flight crew and the pilots. It's not somebody who like flies the plane with their feet while doing surgery with their hands, or I don't know. I've heard a lot of questions about that. So while I was doing that, a couple things started, I started to realize a few things about my role as a primary care provider that just didn't quite sit well with me. I think there was just, I felt like I was just constantly medicating problems, kind of treating them, but never actually solving or fixing the medical problem. There was a lack of emphasis on preventative medicine. And I get because it's kind of hard to quantitate, you know, if you put in this many hours of counseling and so forth, you know, how is that going to relate to better health outcomes? But it just seemed to me that in general in the United States, there was a lack of priority on preventative medicine. And to contrast that, one of the things that I really did enjoy as being a primary care doctor, in the Navy in particular, was that if I did have somebody who came in with like blood pressure that was elevated, a BMI that was out of regs, I could ground them. And the worst thing that you can do to a pilot is ground them. So they would be eager to like, you know, do whatever recommendations you said. So I could send them to the nutritionist because we had that resource. I could say, you're going to meet me at the gym after work and I'm going to show you a new workout program. I could do all the things that I wanted to help them create the habits for the better lifestyle that would improve the health outcomes that we were trying to fix. And they were motivated. But I realized that as soon as I left the Navy, I wasn't going to have that leverage. And that kind of left me feeling like maybe this wasn't the best way to have the type of impact that I wanted to have. I wanted to have a lasting impact in people's health, and I didn't really feel like maybe this was the best way to do it. So after I was honorably discharged from the Navy, I decided to go into more into the clinical research realm. And so I was accepted to the Berkeley Clinical Scientist Development Program and was awarded an NIH K-12 grant. And so what my research involved was using an adaptive optics laser ophthalmoscope, which allowed me to look at the retinas in human beings, in living eyes, and kind of study these inherited retinal diseases. And as I was doing that, I also decided to get my MPH at UC Berkeley, kind of just to help me initially get better grasp on biostatistics, epidemiology, study design, to help improve my research. But in the course of getting my MPH, I kind of had a greater appreciation of public health and how it was one way where you could have a large impact on the health of a large number of people. So in the course of my research, I kind of began to see my studies as an in vivo approach to to this research, because basically I'm looking at the tissue, live tissue on the cellular level, and that kind of sparked my interest in pathology. So here I was thinking, okay, well, maybe primary care wasn't the first thing that I should do. The first thing that I tried, maybe that wasn't the path for me. Maybe I should go into pathology. And then lo and behold, I was discussing this with one of my friends from flight surgeon school. And she's like, have you heard of forensics? And I was like, no, not really. Do tell. And when she explained it, it was just kind of like this light bulb went off. It was this eureka moment where I was like, yes, this is it. It's one of the things that I had always enjoyed about primary care was when I got to do the procedures. I liked a hands-on approach to doing things. And then with forensics, it's basically the marrying of my interest in pathology with public health. And so basically, I began to view forensic pathology as a hands-on approach to improving the psychological and physical well-being of the masses, basically. And what I mean by that, so psychological well-being. As a forensic pathologist, after you finish the autopsy, you call the family or the loved ones that were left behind, the next of kin, and you have the ability to show compassion and give closure and really start the healing process for those who are left behind. And it really does make a tremendous difference in how they are able to move on from that tragedy. And then in terms of the physical or the health of these people, sometimes the cause of death was something like, a natural cause. And so you have the opportunity to explain what hypertensive and atherosclerotic cardiovascular diseases and how lifestyle modifications can help them avoid the same situation that befell their loved ones. So you don't have to die of a heart attack. You don't have to die of a stroke. You can take these measures. And I think sometimes, people kind of hear this all the time from doctors or whatever, but until they suffer a loss, that might be the opening that they need in order to actually hear, in order to actually receive the information and take to heart the information and start making the lifestyle changes that are going to help improve their lives. And then I would say additionally, on the public health forum, you are determining the cause of death, and all this information from all these different causes of death are used and can be informative in creating public health policies that, again, serve to protect the public. And I think also one final aspect of forensic pathology that really appealed to me was that it gives you the opportunity to basically be an advocate for justice, which I guess in a sense still falls under the aspects of psychological improvement, because as you're standing in front of or sitting in front of a jury and giving the testimony, you're helping bringing the truth to light and making sure that justice is served. And being a voice for those who no longer have a voice. And I think that's also extremely important and something that I feel very privileged to do. So it's been a kind of a circuitous route, but I'm very glad that I eventually found my way to forensics, and it's really meets the intersection of so many of my interests, and I'm just happy to be here. All right, so in terms of what is the most challenging part of my career so far as a forensic pathologist, I think it is the necessity to compartmentalize in order to be a good forensic pathologist. On the one hand, when you go to a scene visit or when the body is on the table, you have to approach it with a bit of detachment, a bit of clinical detachment in order to kind of not be overcome or overwhelmed by the circumstances regarding how this person came to be on your table. Sometimes the stories are extremely sad and heartbreaking. And of course, as a human being, you feel for that person. But while you're doing your examination, that's not the time to be overwhelmed or overcome with emotions. On the other hand, afterwards, when you're talking with the family, I think that's the time when you can really let your humanity and compassion shine. That's when you can really, be that beacon of hope, be that initiation of the healing process, really show empathy and compassion for someone in probably one of the most, worst times of their life. Most of the deaths that we're dealing with, these were unexpected and sudden. So it's not as if, the family was expecting to receive this phone call from you. So it's really a chance for you to display your compassion and humanity. So I think the compartmentalization, it can be a little tricky, but it's necessary, I think, and I think it makes for a good forensic pathologist. So I guess in terms of support or other actions that would have helped me along in my journey to more easily make a decision to become a forensic pathologist, I think it would have just probably more exposure to medical school would have been helpful. I think we took one trip down to the morgue at some point early on in orientation, and I really didn't know about forensic pathology until well after I had already gone on this other path of being a flight surgeon, a clinical researcher, and then kind of had to come back around to figuring out what forensic pathology was. So I think that's why it's so important what NAME is doing and other societies in terms of spreading the gospel of forensic pathology and putting it out there, letting people know that this is a great career field, that it's that it's available for you, that it exists. And it's a little bit different than what you see on CSI, but it is definitely a great career move. So that's it for me. Thank you for listening. And I would say, always remember just to be open to what life has available for you. If I had not been open and willing to try new things, I would have never figured out how much I enjoy forensic pathology. And I really think that it is one of the best career fields for a physician to have. Thank you.
I hope these stories from other forensic pathologists have given you some information, answered some of your questions, given you some insight about our field, and helped to further stimulate your interest in forensic pathology. We will be starting some forensic pathology virtual talks through NAME that you can get through NAME's Facebook and Twitter sites. I encourage you to watch those. If you want to become a forensic pathologist and have not already done so, I also encourage you to reach out to the chief of your local medical examiner or coroner's office to ask if you can come and spend the day. If you get rebuffed, call me. Don't give up. I will help. Good luck. Thank you.